The world of medicine is changing. With the rapid advancements in technology, healthcare is undergoing a significant transformation. Artificial intelligence, or AI, is making its way into hospitals. This technology is not just a futuristic concept, it is becoming a reality in many healthcare settings. AI systems like Hippocratic AI's Anna, Cuventus AI Assistant, and Zoltar's human-like avatars have become household names in healthcare circles. While these AI tools are not all standalone nurses, they are assistive technologies designed to support human healthcare professionals by automating administrative tasks and enhancing patient communication. They are part of a broader trend in healthcare to leverage AI for improving efficiency and enhancing patient care, with many notable success stories to report. 1. Boston Children's Hospital successfully implemented AI-powered virtual nursing assistants to enhance patient care. These assistants are voice-activated and integrated with hospital systems, allowing nurses to manage their workloads more effectively and improve patient interaction and care quality. 2. AI-driven predictive analytics have been used to monitor patients at risk of developing sepsis. By analyzing patient data in real time, AI systems identify early warning signs, enabling timely interventions that significantly reduce sepsis-related complications and improve patient survival rates. A study published in The Lancet reported that the Mayo Clinic achieved a 30% reduction in hospital readmissions using AI to identify high-risk patients and customize interventions. 3. Tools like IBM Watson Health help nurses create personalized care plans by analyzing patient data, medical histories, and treatment outcomes. This empowers nurses to provide evidence-based care at scale. A clinical trial conducted by Stanford Healthcare showed that patients receiving AI-driven personalized treatment plans had a 20% higher survival rate than those receiving standard treatment. 4. In skilled nursing facilities, AI-powered virtual health assistants support nursing staff by providing patients with personalized health information, answering common healthcare queries, and assisting in scheduling appointments. This streamlines tasks, allowing nurses to focus on direct patient care and complex clinical decisions. A recent survey revealed that 85% of patients using Cleveland Clinic's virtual health assistants reported a positive experience, citing convenience and ease of access as key benefits. In summary, AI has taken nursing by storm and is fueling significant advances in most nursing areas, namely, patient monitoring and early detection, clinical decision support and care planning, medication management and safety, nursing education and training, and patient engagement and communication. Around the world, this is garnering momentum as well, with the UK, China, the UAE, and India leading the way. The UK's National Health Service, NHS, is leveraging AI for breast cancer screenings, automating administrative tasks, and enhancing patient triage. China is pioneering AI-powered virtual hospitals, such as the Agent Hospital, which uses AI doctors trained through simulations to improve diagnostic accuracy and treatment recommendations. The UAE is investing in smart hospitals and AI-driven predictive analytics to improve patient care. The Global AI Healthcare Academy in Abu Dhabi is revolutionizing nurse training by enhancing AI skills among healthcare professionals. India is focusing on expanding telehealth services and integrating Internet of Things devices for remote patient monitoring, especially in rural areas. While AI offers potential benefits, nurses have concerns. A survey by National Nurses United found that AI technology often contradicts nurses' clinical judgment and undermines patient safety. Nurses reported inaccuracies in automated handoffs and difficulties in modifying AI-driven recommendations based on their own clinical judgment. There is a risk of automation bias where clinicians overly rely on AI recommendations without verifying their accuracy. Additionally, the lack of transparency in AI systems' decision-making processes can lead to mistrust and errors. AI systems can be flawed due to biases in training data, leading to inaccurate conclusions. For instance, an AI algorithm underestimated the severity of health issues in Black patients due to biases in healthcare spending data. Frequently, nurses and their unions raise the following concerns. 1. What is AI's impact on nurses' roles? Will it replace their expertise? 2. Can machines genuinely provide the same level of care? 3. Bias. AI systems are only as good as the data on which they are trained. 4. Privacy and cybersecurity. How do we guarantee that patient information is secure and never misused? 5. AI systems are not perfect and may exhibit hallucinations. When they make a mistake, who is responsible? What is the impact on patient safety? 6. Nursing involves compassion and empathy. Can AI replicate these qualities? While AI has shown promise in enhancing nursing efficiency and patient care, significant challenges remain related to its integration, including concerns about patient safety, clinical judgment, and data quality. Despite the concerns, AI excels in specific areas. It's particularly good at handling administrative tasks. AI can manage medical records, schedule appointments, and process insurance claims. This frees up nurses to spend more time with patients. AI is also a powerful tool for data analysis. It can sift through massive datasets to identify trends and patterns. This can help researchers develop new treatments and improve patient outcomes. In patient monitoring, AI can track vital signs and alert nurses to any abnormalities. This can be especially helpful in intensive care units where patients require constant observation. Finding the balance integrating AI without replacing humanity. The key is to find the right balance between technology and human touch. AI should be a tool to assist nurses, not replace them. It can handle repetitive tasks, allowing nurses to focus on patient care. Human judgment and decision-making remain crucial in healthcare. No machine can replicate the empathy and intuition of a trained nurse. Nurses bring empathy, critical thinking, and adaptability to patient care. These human qualities are irreplaceable. Instead of fearing AI, we should explore its potential to enhance nursing practice. Training and education are key. Imagine AI tools that help nurses make faster, more informed decisions. These tools can analyze vast amounts of data quickly. Imagine AI systems that reduce administrative burdens, giving nurses more time to spend with their patients. This requires careful planning and collaboration among all stakeholders. Nurses must be involved in the development and implementation of AI systems. Their insights are invaluable. This ensures that these technologies meet the needs of both patients and healthcare providers, creating a more efficient and compassionate healthcare system. Ethical considerations for AI in nursing. As we integrate AI into healthcare, we must address ethical considerations. Data privacy is paramount. The sensitive nature of medical records means that any breach can have serious consequences for patients. We need to ensure that patient information is protected and used responsibly. This involves implementing robust security measures and strict access controls. Another issue is algorithmic bias. AI systems can inadvertently perpetuate existing inequalities if not carefully managed. AI systems are only as good as the data they are trained on. Therefore, it is crucial to use diverse and representative datasets. If this data reflects existing biases, the AI system will perpetuate them. This can lead to unintended consequences in patient care. This can lead to disparities in care, where certain groups may receive suboptimal treatment. Ultimately, the goal is to use AI to create a more equitable and accessible healthcare system. This means leveraging technology to bridge gaps in care and reach underserved populations. This requires ongoing dialogue and collaboration between healthcare professionals, technology experts, and the public. Continuous education and training are also essential to keep up with advancements. Only then can we harness the power of AI to improve patient care while preserving the human element at the heart of medicine. Balancing innovation with empathy is key to the future of healthcare. The road ahead. How will nurses' roles change? What skills will be required, and how to transition into an AI-driven healthcare environment? As AI develops and matures, it will have a profound impact on nursing, particularly in clinical care, nurse-patient communication, and nurse training. Clinical care. Patient monitoring systems, including wearable devices and humanoid robots, will become increasingly prevalent. They provide 24/7 service, unwavering attention, and consistent results. AI-driven planning and decision support systems will be commonplace. They will assist in creating personalized care plans by analyzing patient data, medical history, and treatment outcomes, empowering nurses to provide evidence-based care at scale. Automated dispensing systems will help nurses prevent medication errors by cross-referencing patient allergies, dosages, and potential interactions in real time. Nurse-patient communication. Chatbots and virtual assistants will handle basic patient inquiries, freeing nurses to focus on more complex and emotionally charged conversations. In the future, you can expect your first interview and triage in any healthcare facility to be conducted by a chatbot. AI will take telehealth to a whole new level. Telehealth platforms will enable nurses to provide remote care efficiently, particularly in underserved and remote areas. Emotional AI will be the norm. AI robots will utilize their emotion recognition ability to help nurses identify subtle changes in a patient's mood or behavior around the clock, enabling early intervention. Nurse training. AI-powered simulators utilizing virtual reality will enable nursing students to practice clinical scenarios without risk. They will simulate emergency scenarios as often as needed to sharpen nursing students' skills and expertise. Adaptive learning platforms will tailor educational content to individual learning styles, enabling nurses to grasp complex topics more effectively, such as pharmacology or anatomy. AI systems will utilize predictive analytics to track students' progress and identify areas where they may require additional support, ultimately leading to higher competency levels among graduates. So, how will nurses' roles change? The following roles will be in high demand. AI nurse consultants, who can help healthcare facilities integrate AI systems into their workflows, ensuring that technology aligns with clinical needs. Telehealth specialists with expertise in telemedicine and remote monitoring of patients, and data analysts in nursing who can interpret AI-generated data and optimize patient care and resource allocation. The skills required to fill these roles include technical expertise and familiarity with essential AI tools and software, data literacy for analyzing and applying data insights, the ability and willingness to adapt to continuous learning and change, interdisciplinary collaboration to work effectively with AI developers and IT professionals. The integration of AI in nursing is no longer a futuristic prospect, it is happening now and at an increasingly rapid pace. To succeed in this evolving environment, nurses will benefit from the following actions. 1. Exploring courses and certifications focused on AI and healthcare, as many online platforms offer programs specifically designed for busy professionals. 2. Joining professional networks such as the American Nurses Association, ANA, to stay informed about AI trends and best practices. 3. Participating in workshops and hands-on training sessions to gain practical insights into effectively utilizing AI tools. 4. Advocating for ethical AI to ensure that AI applications are used responsibly and equitably in patient care. By following these recommendations, you are actively leading the change rather than avoiding it.